1 minute.
There we go. So hi everybody, welcome to today's webinar. We've got a big list of speakers who are going to be talking about accessing health information online, and there'll be loads of points of view for you to hear from. I think it's going to be really interesting. Just in terms of some housekeeping, if you could all keep on mute when you're not speaking, that would be really helpful, just so we don't get a lot of background noise. I'll try not to mute anybody, but if I do, it's not because we don't want to hear from you. And I will try not to do that. If you want to introduce yourself in the chat, that would be great. Or if you want to ask questions in there too. We're going to try and take all the questions at the end, just so we make sure we get through all of the presentations. But we'll keep an eye on the chat. If you've got any questions because you don't understand what someone's saying, or you need them to slow down or things like that, you can tell us during the presentations. If you just stick your hand up or come off mute and let people know, that would be really helpful. We're recording to put this on YouTube to share with people who couldn't get here today. So if you don't want your face to be in it, it'd be great if you could knock your camera off, because I can't select who ends up in the final recording. And I think that might be all of our housekeeping. So I'm going to hand over to HealthWatch to kick us off.
Okay, hi everyone. I'm going to attempt to share my screen. Is that coming through now?
Yeah, that looks great.
Perfect. Okay, so thank you so much for having me. My name is Erta and I'm Policy and External Affairs Manager at HealthWatch England. And I'm here today to talk about the national campaign called Your Care, Your Way, which is around accessible information in the NHS and social care, which we've been running for nearly a year now. So just quickly before I go into that, some of you may be familiar with HealthWatch, but just in case you are not, so HealthWatch is the independent statutory body which is a champion for patient voice. And our job is essentially to try and gather people's views from around the country on how they think things are going in the NHS and social care and their experiences, and feed that up into decision making and policy making. So I'm from HealthWatch England, which is the national kind of umbrella organization, but there is a local HealthWatch in every area of England, commissioned through the local authorities, which works in local areas to support, investigate people's experiences locally, and works very closely with local services and community groups. And they really act as our eyes and ears on the ground, feeding up all of that information into our national work. So in terms of this accessible information campaign, why did we launch this campaign now? So as many of you might know, the Accessible Information Standard came into force in 2016, and this places a legal requirement on all health and social care providers to ensure that people are given information about their health and care in accessible ways. In particular, we also started hearing more and more from people around the country since the beginning of the pandemic around not receiving support, the support they needed to communicate with health services. And the issue is also in the media. So if you remember the kind of COVID briefings that the government used to give every day or every week about lockdown measures and things like that, they were actually taken to the High Court for not having BSL interpreting at those meetings, as there was a lot of coverage and discussion around that. We also knew that the NHS England was going to review the Accessible Information Standard and update it, so we thought it was a good time to influence the standard and work to ensure more services are fully meeting people's rights to accessible information. So just briefly, I mean, we had a couple of different goals for the campaign. One was around raising public awareness around people's rights, but also raising awareness amongst service providers and professionals around why meeting these requirements is important, but also building up an evidence base for why the current system is not meeting people's needs, and bring together a national campaign coalition to really fight for these improvements. So we've been running the campaign together with a group of national partners. These are the key partners in the campaign that are involved, and I think a couple of other smaller organizations have also come on board since. But we really wanted to make sure that the voices of people with lived experience of sensory impairments and disabilities were at the heart of this campaign, and a lot of these organizations really fed in so much evidence that they have from those groups and their local organizations and patient groups around that, which has been really excellent, and they helped us to develop the campaign as well. And these were some of the organizations that we really aimed to influence as part of the campaign. You know, first NHS England, which was reviewing the accessible information standard, but also the Care Quality Commission, which is responsible for holding services to account for how well they're delivering services, and we thought that there needed to be a lot more accountability in the system for delivering accessible information, and also the transition to integrated care systems across the NHS, we thought also offered an opportunity to really embed accessible information at that level of accountability and commissioning. As well as, yeah, the other kind of stakeholders listed below there, which all have a role in delivering and holding services accountable. So for the campaign, we reviewed the stories that over 6,000 people had shared with us through Local Health Watch over the period of around 2 years. And yeah, over 6,000 people had shared their stories of trying to get support with accessing health services. And it probably won't surprise you to find out that while there were a few examples of good communication support, there were many more that were very disappointing. And this is all online with detailed case studies and stories if you're interested, but some of the key themes that we heard from people was that many people's needs were being overlooked. The right support was not being put in place for people even when they had flagged this to services, or even when it was often inconsistent. There weren't the right systems in place to make sure that services were being proactive about meeting people's needs. In terms of the impact on people, we heard so much also about how when services weren't meeting people's needs for support, they had to rely on family, friends and carers to support them, and that made people feel really disempowered and took away their independence and control over their own healthcare. And often people were not certain of their rights or weren't aware of their legal right under the accessible information standard to get information in different formats. We also spoke to staff as part of this research and found that staff were not always aware, and many of them did not receive the right support and training in their workplaces to pick this up in day-to-day interactions. We also submitted Freedom of Information Act requests to all NHS trusts across the country, asking them specific questions about how they were meeting different aspects of the accessible information standard. And of the 150 trusts that responded to us, only just over a third told us that they were fully meeting the standard based on their own understanding. And that might be even lower, obviously, depending on what they're doing. So we asked them about the specific different steps of the standard, of which the different steps are sort of asking people what their needs are, recording them, sharing them onwards to other services, and then making sure that they're being met. And for example, only just over half told us that they were always able to ask people at first contact about any information support needs that they might have. Yeah, services also really struggled to have systems that were compatible with other services to share this information onwards. For example, when people are being referred on to other services, yeah, only just under, about 40% of services said that they don't always do this. So yeah, that pretty stark picture emerging there of that support not always happening. So I won't go into too much detail on this, but as part of the campaign, we developed a very detailed set of recommendations to feed into the review of the standard. And these are just the top headlines, the categories of where we made recommendations. So the first one was really around accountability, because obviously the standard's been around and in place since 2016, but it's clear that services are often not meeting their responsibilities and seeing this as a bit of an optional bonus rather than something that they're required to do. Then we talked a lot about how to be proactive about supporting services to meet those requirements. So really involving people with lived experience in designing better services, as well as promoting those requirements through an accessibility champion in every service. One of the #1 barriers to meeting the standard that services told us about was around IT systems not being compatible with other services or not having the right functionality to record people's needs. So we made a lot of recommendations around how to improve those, and also around having compulsory accessibility training for NHS staff. How am I doing on time?
I think you've got a couple more minutes.
Okay. All right. So yeah, so this campaign has been running for most of the year. Once we built up that kind of evidence base, we also had all these really powerful stories. So we made some, videos and things like that showcasing that evidence. And we worked really closely with our stakeholder coalition to develop those recommendations. And over the course of the year, we've been participating in the NHS England review of the standard. But also we've been working through Local Health Watch to try and help local organizations to hold services accountable at a local level around this, and reminding them that this is something that's already a legal requirement, as well as running good practice events for professionals and clinicians around how they can improve their support, and also supporting lived experience groups to feed into the review. And where we're up to with this at the moment is that we were really pleased with the initial phase of the review, which really did focus on lived experience and spend a lot of time and effort listening, I think, to both us, but also, the other organizations and real people around what needs to change. And we know that almost all of our recommendations have been included in the draft version of the NHS England review. And we've also been working with the Care Quality Commission to develop a set of universal metrics for how all services around the system can be held accountable, for meeting the standard, and how Care Quality Commission can inspect around that. And I think it's been really positive in terms of awareness raising and bringing together that coalition. But unfortunately, at the moment, the review still has not been published, and we're not clear on the timeline for that. And there is a bit of a feeling that it's sort of dropping off the political agenda a little bit. And so, yeah, that's where we are at the moment. And we're looking at trying to escalate the campaign again into a new phase. We know that as part of the review, the initial intention was to try and roll out the updated accessible information standard from April 2023. So that would mean, not just publishing the review and the recommendations, but also actually taking on board those recommendations to produce a new standard and developing an implementation plan for how to hold services to account for that. So there's obviously still 5 months until that date. We'll be working with those partner organizations to continue putting the pressure on and continue the campaign. So I will leave it there, and hopefully we can discuss a bit more in the question and answer session. There's a link there on our website. There's everything I've spoken about is set out in much more detail, our recommendations, and also the evidence of people's experiences and the FOI results.
Great, thank you, Erta, for sharing about the campaign. We're now going to pass over to SeeAbility. And there's a number of you, so I don't know if you all want to introduce yourselves.
I'll pass over to Grace, Stephen, Lance, Rebecca and Joanne.
Hi everyone, thank you for giving us the opportunity to come and present here today. We are very pleased to be here. We're going to be doing a discussion regarding how we access health information online. I will be doing the leading of it, but I'm working with my other colleagues to try and help them do the best presentation they can. Okay, my name is Grace McGill and I'm an expert by experience at SeeAbility for the Loxhill Eye Care pathway, and I'm also an eye care champion for SeeAbility. And I'm going to introduce the other champions and give them the opportunity to introduce themselves. Over to you guys.
Hello everyone, my name is Lance Campbell. I am also a London Eye Care champion for SeeAbility.
So I'm Joanne, I'm an eye care champion and I'm in the Northwest. Becca, you have to move.
Can you manage Rebecca? Oh, there you go.
Yes,
Rebecca and I work for SeeAbility, and I work for SeeAbility for the last 3 years, and I'm an eye care champion in the Northwest, and I work with Joanne and Dave too.
you do. Yeah, you do.
Rebecca, can you explain what the eye care champion's role is?
Of course I can, Grace. Right, the eye care champion's role is it's where we go out to groups of people with learning disabilities and we talk about how to look after your eyes, and we do presentations, and we will talk, and we will sometimes do an icebreaker, and we will talk to different groups about how to look after your eyes and explain how important it is to look after your eyes.
Thank you very much, Rebecca. Okay. Next, I'm going to be asking everybody in turn how they access their health information online. And I'm going to start with Rebecca. How do you search for health information online, Rebecca?
I will type in a specific question like how many people are hard of hearing, and I will get a specific answer.
Joanne, how do you search for health information online?
So I'm outside my role as SeeAbility, I sit on a different group. So I sit on the letter reviews, so for the deaf of people with learning disabilities. So I usually look on the NHS website, and sometimes I sit on that group and I make their report. The report's not very accessible into easy read, so I do a lot of videos of my voice being recorded to make it more accessible for the report to go to NHS, because it goes through to NHS, how report the death of somebody with a learning disability and autism, and that gets reported to LEDA and what happens to it after.
Okay. Lance, how do you search for health information online?
So I would Google it. I would either Google it or I would ask a family member about it. but we know that not that many websites can be trusted, but I tend to use the gov.uk website when it comes to health, because it's more accurate.
Yeah. Okay. Well, how access health information online? I do Google things, but recently I've given up Googling things because you don't always, as Lance says, get the trusted health information. And sometimes you can get horror stories about treatments and things like that. The reason I don't look at horror stories like that is because I don't need anything to make me worry even more than I already do. And I also ask professionals, for example, GP consultants, learning disability nurse, as this information is from a health professional that you can trust. Okay. Rebecca, are you able to say what software and devices do you use?
I will use a laptop when I'm at work, and I use Read and Write when I'm at work to read emails out to me. And I will also use that, and yeah, so I use Read and Write to read emails out to me so that I'm more productive at work.
Rebecca, where did you get your Read and Write from? Where? Who from?
Access to Work. Access to Work is a government organisation that provides reasonable adjustment for people with a disability in work. Access to Work provided it.
Yeah. How would your job have been, Rebecca, if you didn't have that software?
A lot harder. It would have been 3 times as hard to read emails, and I would have been a lot slower at the job. So the software makes me a lot more productive.
Okay. Joanne, what software do you use? And
So I use the
devices?
same as Rebecca. I use Read and Write for my software, and I use Dragon. So Dragon actually types an email for me. So I actually speak to my computer when I got a nice headset, and it'll actually pick up my voice. It will actually know it's me speaking to the computer. And I use for work, I use my tablet, my work's tablet. So works give us a tablet, and I've got software on that as well, so I can always speak into the software and it'll know my voice, so it'll recognise it's me speaking. Isn't it? Right? Isn't it?
That's good. I also have sight loss, so I have a magnification program on my computer called Supernova, which magnifies all the screen, and I often use a high contrast, so I reverse the colours. This makes it easier for me to read. It took me a while to get used to it. It was also funded by Access to Work, but now it makes my job a lot easier when you can see what you're doing. Okay, the next part of this talk is about eye care resources. So I'm going to hand over to my colleague Lance.
Thank you, Grace. There is a presentation for this, so
You can share this. You can share it if you want, Lance. You can share the screen.
Yeah.
It helps, yeah.
okay. So SeeAbility has forms that you can use, and the first one is about me and my eyes. Well, actually, I'm gonna actually, no, I'll tell this in order. First of all, the first picture is about having an eye test. And this is just an easy read fact sheet. This is an easy read fact sheet about eye care and having an eye test, and it explains in easy read what the optician, how the optician can test your eyes and what it's all about, and ways of which you can have an eye test. Then we have the last one is about me and my eyes. This is for the individual to fill out for the optician so that they are aware of the eye condition before they do the eye test. And it's also a way of knowing how to communicate with that person if that person has specific needs. And then we have the eye test results. This is for the optician to fill in, to give to the individual, their support worker. It's to fill in, the optician fills it in and explains their results and explains their condition and explains what they need to do to move forward and how they can help.
You're sending this slide.
So for further information, SeeAbility has a bunch of easy read resources on our website that you could use about glasses, eye tests, or eye conditions, and they're all in easy read. You can contact SeeAbility if you require any help in terms of how to look after your eyes.
And on our website you can find their local.
Oh yes, and you can
I just reminded you then.
Thank you, Joanne. On our website, we also have a Find an Optometrist page where you can put your address and it can show the nearest optometrists in your local area. And also we have the Accessible Information Standard, and the NHS are required to provide these information in accessible format, and they're called the Accessible Information Standard, and there's more information on this link over here.
I do know somebody though who was completely blind and the hospital gave her information in large print. Which is crazy.
Definitely.
Not very good.
Even though she'd asked for the information, either email, audio, basically, or braille. Okay, during the COVID-19 pandemic, we have all had to adapt to learning new skills. We've been working as eye care champions since 2019. And when we first started our jobs, we weren't using the amount of technology that we are using now. This is because of the COVID pandemic. And believe it or not, before I started having to use technology like Zoom, Teams, Skype in those days, the thought of it freaked me out. And I needed a lot of support from Steve, Lance, Rebecca, Joanne, and other colleagues that we had then to manage to do my work in while adapting to being in lockdown, not being able to see any people, having to do meetings online and not in person. It's mental. And I'm much more happy to do, and I'm happy to use technology because it doesn't faze me anymore.
Grace, I think we might have lost you a little bit there. Do you think you could say that last bit again, your last sentence?
I used to be anti-technology, but now it doesn't faze me anymore. Which is a good thing. I covered everything, Steve.
I think so, Grace. Was it just the last bit around sort of about being in employment and what difference that
Yeah.
has made to you and the champions?
Yeah.
Do you want to say a bit about that?
The pandemic may have stopped people working together, but it's not stopped the friendships you make.
And it's really helped you to, I think being in a paid role is something that the champions have said has helped you to develop your skills, you know, using technology, being online, being on Zoom and Teams and so on. You've been able to access training alongside your work colleagues, the same training adapted to yourselves and your needs where it needs to be, but it means you've kept up with other people. And we found that sometimes people who are not in a paid role or even not in a volunteer role miss out on those opportunities and don't get the same chances to learn skills as other people, and they're at a disadvantage. So it's been brilliant for the champions. They've done brilliantly, but it's been a great opportunity to be in employment and to learn those skills as they go along.
And Steve's helped me on my journey to my major.
Doubles on all our journeys, haven't you, Rebecca?
And everyone else's manager.
Yeah, is
I
there
don't know if anyone else wants to say anything.
No, I'm happy.
Yeah.
One.
Rebecca, Lance, do you want to say anything else?
Rebecca's amazing.
I think that we all enjoy doing what we do and love what we're doing.
We do. We do enjoy.
There you go.
Great.
Rebecca, do you want to say anything briefly? You're on mute.
No, I'm fine, thanks. Yeah, it's been really good to be in a paid role, and it's been really good to learn those skills. It's been fantastic. I feel that I've made fantastic progress. What do you think, Steve? Over the last 3 years?
Definitely. You've made brilliant progress in lots of ways. Technology, confidence, giving presentations, all sorts. So it's definitely made a big difference to yourself and for the other champions.
Yes, I would agree a lot there. I really, really would.
Brilliant. Okay, Grace, do you want to say the final thank you?
And I would just like to thank everybody for listening to us and hope that you have learned something from today.
Great. Thank you all for sharing about your experiences and about where people go find information about eye care. I think that's really useful. And now we're going to pass over to Keyring.
Hi everybody. So I always seem to be following SeeAbility. It's a really hard act to follow, but we'll do our very best. So hello to everybody. My name is Michelle. I work for Keyring. My job is as a practice development lead. So I'm really looking at getting the best out of the support on the ground and how we can do our best for the people we support, who we call members. So we have Leighton and Sam with us today, who are going to talk about how kind of Keyring looks and feels in Oldham from a health and digital perspective. But let me just share my screen. This is where you will pray and cross your fingers. There we go. Is that okay? Just okay. So, and in true fashion, it's completely froze for me. So that is not great. Oh no. I can't get it onto slideshow for some reason, so I'm just going to leave it like this. It's good if I mess around anymore, I'll probably lose the whole thing. So Yeah, so as I say, my name is Michelle Lloyd and I'm here with my colleagues Leighton and Sam. So I wanted to talk about our sort of digital journey as a provider, really, working in a very difficult industry that is social care, and really thinking about how Keyring has kind of had to kind of adapt and change over the last couple of years, and how being part of the Creating Connections programme has really helped. Thanks for that, Rachel. And how being part of the Creating Connections programme has really kind of helped us as an organisation kind of think about how we work digitally, how we get more members that we support to access support and information online. So I thought this was a really good graphic because it kind of shows really messy footprints and kind of really shows Keyring's journey, I feel. And we're very honest about that actually the footprints are kind of a bit scattered, where we've had to kind of step back a bit, we've gone forward a little bit, we've had to change things. So I just thought that was quite a good graphic, really. So we're a national support provider. We work all over the country, and 2/3 of the people we support have a learning disability. And as I said before, working on the Creating Connections programme and really having a digital focus has been great. But what has been even better is actually working with partners who are actually on the call today. So particularly AbilityNet and SeeAbility and Learning Disability England, just for their general support and knowledge and guidance, really. And we certainly wouldn't be where we are without the support of our colleagues. So we just wanted to thank them, as I do every time I see them, which is always a pleasure. So just a bit more about Keyring. So Keyring are all around supporting our members to build the life that they want, and actually working in their local communities and accessing local community resources. But we also know that digital access and digital inclusion is key to living the life that our members want. And we have some fantastic support teams on the ground who help our members develop their skills and confidence around health, but also around how to access the digital world. And we also really encourage members to share that kind of knowledge and resources with each other. And we do that through local community hubs, as well as during one-to-one sessions. So Keyring's core work is around supporting members to build independence, and actually that connecting with others is really vital to living a meaningful and really fulfilled life. And we know that digital plays a massive part of that, and we saw over COVID about how great it was when people were able to connect using video calling, and that still remains one of the largest things we focus on as an organisation, because we know how much that connection is vital, really. Thanks, Rachel, for being my person. Okay, so yeah, what are our digital goals for people? So I very much lead on our digital strategy, and with support from Creating Connections, the programme and its partners, we are able to kind of support our members to get online and to gain those digital skills. But we also really acknowledge that we have to look at the barriers as well. So the Creating Connections programme has enabled me and colleagues to access free digital equipment such as tablets and phones and free data, and able to support and source specialist equipment as well, because as we all know, cost can be a real barrier for people, really. So by getting that equipment out there and setting up the digital hubs that we have around the country, we really started to create that desire to learn more about digital, which has been fantastic, really. So yeah, so we just needed to get the equipment out there. We needed to make sure that members then were able to kind of develop their skills, and we did a lot of mapping initially, what was needed, and that's where the Creating Connections programme really came into its own. And obviously, the digital world really helps in building members' independence, and we know that a lot of things can't be done without having that digital element. We didn't want people to be left behind. So again, from the knowledge and skills from partners and developing training programs, and that has been a major part in supporting that independence build-up, really. And what we did as well, we created digital champions in each area. Again, they were really vital to kind of really carry on that programme. And the digital champions were made up of the members we support, our volunteers, and our support staff as well. So but what we also did was set up an internal resource portal that the teams could actually access and pull off. We developed session plans and all of that. So the teams around the country could really create bespoke packages depending on what would work in their region best. And yeah, so health resources were a massive part of that portal that we developed, and how to access health information and the importance of looking after your health is obviously one of our major topics that we talk about across our hubs. And that moves me really swiftly on to introduce my colleagues Leighton and Sam, who are going to talk about all of the great things that they're doing in Oldham around health and how they use online to support that work. So I will hand over to Leighton and Sam.
Hi, thanks Michelle. So yes, as Michelle said, my name is Leighton and this is Sam.
Hi.
What we wanted to talk about first was how what our jobs are in Oldham and how we got the funding for it. So Sam is one of our members as well, aren't you, Sam?
Yeah.
Along with another lady called Katie, who we employed through the funding to work alongside myself to do a project at first for the COVID recovery work across Oldham, didn't we?
Yeah.
So in that situation, and for that first project, it was funded by Action Together, and they gave us some money to basically be the COVID champions, didn't we? COVID recovery champions for the learning disability and autism community in Oldham. So that was to help people understand how serious COVID was, how to get vaccines.
Yeah, we also did testing, how to test if you've got COVID.
Yeah. So how did you show people how to test?
With what's it called?
The swabs.
With the swabs, yeah.
So you showed them online, didn't you? So we took pictures, didn't we? You didn't want a video.
No.
But so instead what we did, we took pictures of every step, didn't we? Every step of how you did the test. And then we posted them all over our Keyring Facebook page. One was directly for Oldham, for members of Keyring and for our community, but also across the national Keyring Facebook page as well. And that showed Sam in the pictures of how to do this test, step by step, very easy steps, and then very easy instructions. And that was shared for people to understand how to do it better. Because the booklet you get isn't easy read, unfortunately. So we thought, what better way to do it is by people, a face that's recognised, and explaining it easily. Yeah. So going on from the COVID recovery work and the amazing work that Sam and Katie have been doing, we actually got some more funding from Action Together again to spread out into all health for people with LD and autism, and for the community to understand better how to help people with learning disabilities to access services. As a lot of people were coming to us, weren't they, Sam? With how difficult it was to get online, especially with booking vaccines, booking flu jabs, booking appointments sometimes now online as well, which is really difficult. And so we got to work, didn't we? We created some, we have community hubs across Oldham. And so we created a health corner in every hub. So we sat down in them corners and we invited people to come to us. We gave our number, we spread our number out to everybody. And it really picked up. A lot of people needed a lot of help. And so what we did is we started searching online as well, didn't we, for easy information that we didn't have to rewrite ourselves and not reinvent the wheel, because that would have took a long time to do, wouldn't it? So, so instead, we found, like on the NHS website, there was a lot of easy read information of different health concerns, and a big one that kept coming up to us was diabetes, wasn't it, Sam?
Yeah.
So Sam, would you like to speak a little bit about that?
Yeah, I helped a member because he'd recently been diagnosed with diabetes and I myself have diabetes, so I told him about
Your experience.
my experience with diabetes, and also went through Easy Read with him.
And you showed him the websites,
Yeah.
didn't you, and how to access them.
Yeah,
So you helped him access the website himself, without not just us showing them. You actually went and showed and explained how to do that to it for himself, didn't you? As well.
and also when I went to see my nurse, told her about my job role, and she gave me some Easy Read leaflets about cholesterol, diabetes, and high blood pressure.
So you actually accessed that for other people as well, didn't you?
Yeah.
So you brought them to our health corners, because not everybody unfortunately can get an appointment at the moment. It's quite difficult, I think, as we all know, to try and get some appointments with how stretched things are. So as much as we could, we was trying to find the information for people and help people build their skills in our health corners. And as we know, it's not always fun to sit and listen to people explain things. So we actually went searching for different ways to do that online as well, didn't we?
Yeah.
And we came across a game called,
Bingo.
that's right. So it was a bingo game about diabetes called Bingo. Not all of it was easy, was it?
No.
No. So the words on this game were very, very medical, but a lot of words that you would come across if you've got diabetes. So we decided not to change it very much, didn't we?
Yeah.
Because we thought if we changed it and they didn't know what these words meant, then what's the point, really?
And we helped people who found it difficult. We helped them.
Yeah. So we used
the bingo.
We did. So we figured out what these words meant, didn't we?
Yeah.
And then so people might not be able to read the words, some of the words, even I couldn't read some of the words, could I, Sam?
No,
we had to,
none of us could read some of the words.
Really difficult.
Really difficult words.
But we put easy read information with them about what these terms meant. So if they came across that with the doctor and a doctor said these words, they would at least know, they'll recognise the word and at least they know what that means. Yeah. And help people understand in that way, wasn't it?
Yeah.
And that was a really fun way of learning. And everybody in the who joined the health corners really found it fun, and they learned a lot, didn't they?
Yeah.
Yeah. So leading on from that, we had been planning for months, and it's been a lot, quite a lot of work, hasn't it?
Yeah.
And you've done brilliantly as well. A health event that we for the whole of Oldham, for people with LD and autism and their families, and other organisations to come along. So we had MENCAP come along, an OPAL advocacy group. And we worked with a lot of different services. So SeeAbility was one of the services that came out and did a wonderful job. We had the learning disability nurses for Oldham and their partners, which were the physio, psychology, and remind me.
Is it the one that was in the same room as SeeAbility?
Speech and language.
Yeah, speech and language.
And speech and language came all from the learning disability nursing team.
Yeah.
And on top of that, the final person that was there and who actually gave us the building to use was St John Ambulance. So at this event that we planned, with a lot of help from you, Sam, and from Katie, our other colleague, it was very successful. It was only just on Monday that we had this event. And they had access to all these services. So a lot of people came to us saying that they couldn't access services much, couldn't they?
And we also showed them to the correct room.
You did. You made sure everyone was in the right room and everyone was getting to the right places. But a lot of people that came to this event were struggling to access services, weren't they?
Yeah.
So they were struggling to get to see the LD nurses, or they didn't know who the LD nurses were.
No.
They didn't know how to find that information, did they? So we thought, what better way to do it than to get everybody involved in a big event where they can have fun, they can do some games around health, they can learn about eye care, they can learn about how to save a life, and loads of different things that they enjoyed. And it gave them the link to these services, and they got to know the nurses, they got to know the different services around Oldham and get their contact details, and then not feel like they couldn't approach them themselves. And give that independence back to themselves as well. So coming from that, that's where we're carrying on from now, aren't we?
Yeah.
So we're still doing the health corners. We're still going to have access for the whole of Oldham, and anybody who would like to come along to them to get access to the health services and find some of that information and learn some skills.
Also been advised to that.
Yes, speaking.
Yeah.
Yeah. So due to the other event, St John Ambulance actually has invited Sam and myself to teach their volunteers a little bit more about learning disabilities, haven't they, Sam?
Yeah.
About how to work with people more and understand better. Yeah. But I can hand back to Michelle.
Yeah.
I think we've explained a lot of what we've been doing, haven't we?
Yeah.
And hopefully people like to hear, have enjoyed what they've heard.
Thanks ever so much, Leighton and Sam. I think, you know, we're really hands-on in Keyring, and it's such a great example of how we really try and work on the ground to kind of create that best outcomes for people, really. Getting in guest speakers, and I know that Leighton has worked exceptionally hard on the health events, you know, to really try and connect people with both online and in person, because we do recognise not everyone can access online, but it's about having that information, isn't it? It's about trying to get it out in as many different ways as possible, just making sure that we're connecting people with services, and it's in the best way that suits the members, really. So I would just like to thank Leighton and Sam again, and thanks ever so much for sharing your stories. So thank you. Over to you, Rachel. Thank you very much.
Thank you very much, Sam, Leighton and Michelle. It's great to hear what's been happening in Keyring. And now we're going to pass over to our final speaker from AbilityNet.
Hi, good afternoon, everybody. My name is Alex Barker from an organisation called AbilityNet. I'm the disability consultant here, and I will just share my screen and then we can start. So just a little bit about AbilityNet. We support people of any age living with any disability or impairment to use technology to achieve their goals at home, at work, and in education. We do this by providing specialist advice services, free information resources, and we want to help build a more accessible digital world. And it's only on slide 1, and I need water. So we have lots of free resources. We've got over 300 volunteers, and they can solve IT issues either remotely or face-to-face. We have fact sheets on webinars and how-to guides, and they are all available on our website, which is abilitynet.org.uk. We work quite closely with charities such as Keyring to make sure that some of their users are provided with devices, because some of them are digitally excluded. And we've got to say a big thank you to a company called Lenovo for the Connecting You project. Just a heads up, it is going to be running again next year. We've also got lots of news and blogs all on our website. So I just wanted to go away from how the NHS give clients information to some of the technology that can assist patients to independently understand what the information is. So we've just got 4 examples here. Going from right to left, we have Seeing AI, which is an app devised by Microsoft, and it runs on iOS devices only. And basically you can use Seeing AI to read a letter or to read a leaflet. Next to that, you've got Envision app, which does the same thing, but it's not as advanced as Seeing AI. The app on the right is but if you're getting any information by email, and I realise that sometimes the NHS would prefer to send you a letter with some information in rather than an email. And if you've got vision impairment, the screenshot down below is a magnification app which is built into Windows. Just wanted to give a shout out to an app called Be My Eyes. So Be My Eyes will put you in touch with a volunteer who can read a document, or who can tell you what tablets you've got in your hand, or who can tell you how much medicine you need to take. Be My Eyes is a volunteer-led service, and it's very, very effective at what it does, and it can put you in touch with anyone from anywhere around the world. So, for example, my colleague and I, my colleague Chris and I were doing an event in London, and we had a can of soft drink in our hands, and we were able to ask a guy from Iran to identify what can of drink we had in our hands. All of these apps are totally free of charge, and they just make it a bit easier to be independent. When I was doing this presentation, it occurred to me to say that, or to think that sometimes you need to think out of the box. So sometimes it's really hard for people to get in to see the doctor or to go and see someone at the hospital. And it occurred to me that hospitals and the NHS in general could be making more use of communication apps. I'm aware that there's an app called Access Anywhere, but I'm also aware that for some people that's really difficult for them to access. So from left to right, we've got a FaceTime icon. So FaceTime goes on an iOS device. We've got WhatsApp. WhatsApp will go on an Android device or an iOS device, and of course we've got the old favorite Skype, which has been around for ages. And if you get an email, or if you want to find out information but you're dyslexic and you're finding it really, really hard, there are lots of OCR scanners. So OCR stands for optical character recognition, and they will be able to scan documents in, and you can use the built-in text-to-speech reader to read out text. And there's also voice recognition. So for example, if you're not very good at using your hands and arms, but you can speak fairly well, you can actually find information out just by using your voice. We talked about text-to-speech previously. There are various text-to-speech apps. The one on the left is the inbuilt Apple product. The one on the right is the inbuilt Google device. If you are using a Windows computer running Microsoft Edge or or Google Chrome, you can have information read out to you by Natural Reader or by one of the other text-to-speech readers, again, free of charge. We've got lots of information on our website under My Computer My Way. It talks about how to set your device up for your particular requirements, and I certainly think that might be worthwhile looking at if you can. If you want to get in contact with us, you can contact us on 0800 048 7642, or you can email us at inquiries@abilitynet.org.uk to get some friendly and independent advice. And that's how to contact us again. And I'd just like to say thank you for letting me speak, and that is the end of my presentation.
Thanks, Alex. Really useful to share lots of different ways that people can find the information themselves. Does anybody have any questions for any of our speakers? You can give us a wave, or you can pop it in the chat, whatever any of you like. Mary, got your hand up.
Thank you. For me, I find it quite hard getting information because not only do I have learning disabilities, this is why I've come on today, is because I'm also a carer, because as I put in the chat, my husband's completely blind. So accessing information, I could quite agree with Rebecca and the team about trying to read information leaflets, or I think it might not be Rebecca's team, one of the speakers saying about information leaflets, because my husband's been put on some life-saving medication, and it was about this size, 20 pages thick, and it had the most tiniest writing possible on it. So and it's really hard to get my hospital to listen to me when I'm asking for information, just simple information like how often does he have to take the medication, what the name is, how often he has to take the medication, and if there's any side effects that we particularly have to look for, because the new medication he's on, he can bleed more, so we need to know that. But I only knew that because I've got a friend who's a retired nurse who's able to go through it with me on the video call. So if I'm struggling, how many more people are there out there struggling with information like this? Because it's not only about people themselves who've got learning disabilities who need that information, but if you're also a person with a learning disability or autism and a carer as well, you need that information as well. And I keep bringing it up at every meeting we have conversations around this. I'm sorry, guys, but it's really frustrating.
I think that's a really important point to make, though, Mary, and I'm glad that you've brought it up. You shouldn't feel like you shouldn't bring it up. Yeah, it's really important, isn't it? It's tiny writing that you normally get with medication, isn't it? Really inaccessible. Do any of the people who've spoke, have they heard of other people who've struggled with things like that? Not to put any of you on the spot.
I think it's a constant struggle, isn't it, really? Certainly from the teams around the country and the work that we've been trying to do around getting the right information out there. There's still such huge pockets where there are some major issues, and instructions actually are, you know, not only for tablets, but actually for everything. You know, is still a constant struggle. I wish I had the answer, but I'm hoping colleagues, particularly from Health Watch, if you are looking at accessible information standard and things like that, it's getting the messages across, isn't it, to the people that do these things. But unfortunately, it's a all too common story. I wish I had an answer. I wish I felt like I needed to give a magic answer, but I really don't.
Thanks, Michelle. Does anybody else have any questions?
Rachel, can I just come back on that to say it's also complicated because because I'm not the patient and my husband's the patient. Even with his permission, sometimes some doctors and nurses refuse to speak to me, even though he's completely blind and I need it to know it.
Yeah, it can make things really difficult, can't it, if doctors won't have a conversation with more people. Yeah, thank you, Mary. Anybody else have a question? Have something they want to share about how they're doing accessible information? Stephen.
Thank you. Yeah. I just wanted to say a bit about the accessible information standard, really, just from our perspective, because in theory, when it was introduced, it should be a fantastic thing. It should be the answer to a lot of our problems, you know, genuinely helping people to receive information in their preferred format. So it should have been really, really good. But for whatever reasons, it hasn't worked out like that. And it just goes back to the first presentation about, and Grace's comment really about how much is it actually put into practice, how much a health service is able to put that into practice. And it's been disappointing that we haven't seen more information available for people in easy read or large print or braille or an audio. And it's tough. You know, we know our health services are under pressure. We know that they're underfunded. So you want to be sympathetic, but as a whole system, you know, when something's introduced like that, you do want it to make a difference, to benefit the people that it's sort of with the intention was there for. And so that's disappointing. And you know, you do wonder, one of the things is that what is the comeback? What's the consequence if a hospital is not producing the accessible information? What can people do? And I don't know if there is much of a consequence at the end of the day. So they carry on sort of not doing what we want them to do. And that's the frustration, really. And the people in this webinar are the people on the receiving end of that who are struggling from day to day for themselves and for their carers, and being let down because that legislation, which is well-intentioned, has not been introduced and implemented properly.
Thanks, Stephen. In the chat, Annie said that they're currently updating and revising the standards, and maybe now would be a good time to send a collective response to them about that. Is that something that people on this call think might be a good idea?
I think it would be, if there's still the opportunity to influence things, then I think that would be really good. You know, we've got lots of individuals and organizations in this webinar who I think we all probably saying the same thing. So I think it would be a good opportunity.
Annie, I don't suppose you know any more about that.
I was involved in just giving some lived experience I don't know, maybe a month ago, but I understand it's sort of ongoing, but I don't know any more than that. I was just invited to a meeting.
Does it really go back to it's interesting, the first speaker, Urta, was talking about that, wasn't she? The review of the accessible information standard, and had some involvement in there. So I wonder if that might be our link, perhaps.
Yeah, Urta, I don't know if you're still there, or if there's a way for people on this call to connect in more with the work that you're doing.
Oh, hello. Sorry, my camera's being slow to start. Yes, yeah, I mean, really recognize what Stephen has said. It's so unfortunate, and it's sad that something that, you know, is a really useful document is just not being implemented, and there's very little accountability in the system around it, and that's been a huge part of what the campaign has been about. Yeah, if please do get in touch with me directly. It would be great to have additional organizations sort of signed up officially to the campaign, and essentially what we will be gearing up to do if we don't see a very clear plan for an announcement of the review quite soon. We'll be gearing up for a new phase of the kind of public facing campaign. So it would be really fantastic to have more and additional organizations and voices on board as part of that. So yeah, either email me or just pop your email in the chat and I will make sure to follow up.
That's great, thank you. That feels like a really useful way to connect, doesn't it, around the standard?
Actually, I was going to say, although I really enjoyed presenting here today, I feel like a bit of the odd one out, because it occurs to me that the NHS are just not providing the information in an accessible format right at the start. So we shouldn't be having this discussion about what might help people. It's about making sure that people are given the information in an easy way that they can understand, isn't it?
Yeah, I think so. And it's what the standard is one way of making sure that happens, I suppose.
Mm.
Yeah. Anybody else have anything that they'd like to come in with? You don't even have to put your hand up, you can just come off mute.
Hi, yeah, I was just wanted to add as well, I don't know about anybody else, but I think there's a general recognition when it comes to health information, a general lack of recognition when it comes to health information, that we don't all speak doctor language. And I think actually there's this bit of confusion about easy read and accessible, but if you start with in mind a busy person or somebody who's maybe whose first language isn't English, that's a great way to start. I think sometimes we mystify things far too much, and actually it's, if we can even start with something that's written in accessible language, and it makes it easier for translation, it makes it easier to put things into an easy read. And I just think if people just spoke more like normal people, that would be a really good place to start. And that's going to be about changing the culture and always saying, I mean, if you look on Twitter now, there's language matters. It's coming up in our feed quite a lot. So yeah, I just wanted to point that out. It's not this mystical thing. We could start somewhere.
Thanks, Charlie. I think you're right, and it's not just about the letters or leaflets that people get, is it? It's a lot of the time the in-person conversations we're having as well, which are really difficult for people to have. Fabulous. Any more, or anything that anybody's doing in their organisation that they would like to share? Oh, you're all very quiet today.
I just wanted to sort of say about the Creating Connections programme, really, that obviously we're part of, that's been running since sort of 2020, and just how beneficial it's been. You know, that's been a real game changer, really. To access that little bits of money and then to see the difference that it's made. So, you know, I think the key is always looking out for those small bits of money, but it shouldn't be that way, should it, really? You know, but it's fantastic to have such great partners and people who are really invested in kind of making digital work for people. So, and just to thank my colleagues for fantastic presentations.
Thanks, Michelle. Grace, you put your hand up.
Okay. My other role, my expert by experience role, involved working with another colleague at SeeAbility called Trevor Hunter, who's the pathway coordinator. We're trying to get commissioned in London eye care pathways for people with learning disabilities to try and assist with sight tests in a different way so that it's successful and in primary care rather than in a hospital setting where possible.
That sounds like really important work, Grace.
And we already have the pathway in the Northwest, so we have it in Cheshire, Mersey, Greater Manchester and Lancashire. So we've already got it in the 3 areas for the Northwest, so we're leading the way out in the Northwest. We've got it in the 3 areas, and we still, me and Rebecca's role is to make sure people are using the pathway. Our job is to make sure people are going to use so these are information, Grace, these are information in the optician pathway, aren't they?
Yeah, because so many people think, oh, my daughter, Sally, can't speak, so she can't have an eye test. But there are so many ways that they can do an eye test. You can use K-pictures, Cardiff cards, matching cards.
Yeah.
Even looking in the back of your eye with a retinoscope, the optometrist can work out what the prescription of your eyes, and you don't need to be able to speak. And if we can try and avoid people unnecessarily going to eye clinics when they could easily be seen at the opticians with a few reasonable adjustments, then that's got to be better for everyone.
So in the Northwest, we are trying to sign up some more opticians. So in Lancashire, we haven't got many. We're trying to get more people to sign up their local opticians. Aren't we, Rebecca, in the Northwest? You need to unmute yourself, Rebecca. You're on mute. I'm lying on Rebecca there.
Yes, that's right, Joanne. That's why I went to Keyring on Monday.
Yeah, so we went to
didn't you?
Keyring on Monday, yeah, to get some people
Because we're
signed up.
trying really hard to promote this pathway.
Yeah. The more community support, the better.
The more people use the pathway, the more likely it is to stay, and the more people will know about it.
Yeah.
It's true, it's true. And where can they find the information, Rebecca? What website?
On the SeeAbility website, make sure you click on the SeeAbility website.
So we have a
Which is-
map, we have a map, we have a map where they put the postcode in and it search for
Yeah.
the local optician right along the pathway.
Yeah.
They're on the pathway, so they're actually on the special
Yeah.
path.
Yeah. So waits in hospital eye clinics can be very, very long. Sometimes you could be waiting 4 to 9 hours in an eye clinic, depending on how many patients they've booked.
So instead, the hospital, they could use the pathway, couldn't they? So.
Yeah. Yes, basically the pathway will be able to help anyone have a sight test, regardless of their needs. Because at the moment, a lot of the people who can't be seen in primary eye care are being dumped in the eye clinic because there's nowhere else for them to go.
Thank you for sharing that, you guys. And Joe's put the link in the chat for anybody who wants to go and have a look at that map and see what's local to them. Yeah,
And if anyone needs any information about the pathway, I put my email address in the chat.
Great, thank you, Grace. Wonderful. Are there any final comments, or should we wrap up there? I think. Anyone else got anything to add? No. Oh, Mary.
Rachel, I just put in chat that we're doing a project with Sheffield Council on social care and the services they provide for learning disabilities called I think I wrote it, called Chance to Choose. It's all right, I have to read it, otherwise I forget the title of the project. Sorry guys. I can remember it when I'm typing it, but when you try to remember it in your head, I don't remember it. That's what we're doing, and that's around social care and the way they're moving the services in Sheffield. So I just thought I'd let you guys know, and also to say that was it SeeAbility who had the presentation on Monday with the learning disability health team? Was it SeeAbility or one of the other teams?
It was me and Rebecca, so who was delivering. You mean the one in Keyring?
No, it was about you having your nurses from learning disability team speaking to you. It was one of the speakers, I'm not sure who said it, but we had a similar event. We had a similar event on Friday as well, and our drama group did a play about accessible getting information in an accessible way as well, because we have a drama part of Sheffield Voices as well that we run. So, and that's going up on YouTube. So eventually, so if you just put Sheffield Voices drama in, sorry, I was trying to remember that off the top of my head, you'll be able to see the videos we've done around different access needs, and Sheffield Voices have done a lot about accessibility as well. So I just thought I'd add that in, guys.
I did see your message, Mary. It was about the health event that Leighton and Sam were doing on Monday, I think, talking about the learning disability nurses, and SeeAbility gave a presentation. So, but it's great to hear about your event, Mary. I'm certainly going to go on YouTube and have a nose.
I wonder if you could maybe share the link with me, Mary, and I could share it with everybody who's come today when it's live.
Yeah, I'll find it and I'll send it to you, Rachel.
That'd be great. Thank you. Wonderful. Well, I think we will end it there then.
I think there was a question, Rachel. Was it Aaron, or was it Aaron wanting a question, I think, in the chat?
I think it's a question for me. It says a question for Aaron.
Oh.
From a shaming man.
Are you there? Can I help you unmute? Oh, okay.
I've got to go now. See you later.
Steve, just to let you know, I've got to go now. All right.
Okay, Rebecca, no problem. Thank you.
Yeah.
Thanks, Rebecca.
I've just got to go. Yeah.
Yeah, I just typed my
Cheers, I'll see
question
you next time.
in
All
the
right.
chat.
Thanks,
Cheers.
Rebecca.
See ya.
Oh, all my screens moved. Did we have a?
Then they start speaking when Rebecca was.
I think he's trying to say questions for each people who talk about their organisation. How are you going to promote your company? I think that was the question. Maybe, Aaron?
Yeah, I typed my question in the chat.
Thank you. So for the people who are presenting, that was the question that Leslie just told us. How are your organisations promoting what you're doing?
So we'd see that for us from the Northwest, so I'll speak for us because none of me left from the Northwest. We go out and deliver training to staff advocacy groups, to professionals. So we do it online or face-to-face for SeeAbility. And that's from the Northwest team. Nice because Rebecca's disappeared. So, and we promote the pathway for SeeAbility. Am I right, Steve? Am I right on that? I'll get spot on. I'm lying on Steve now.
Yeah, spot on, Joanne.
That's
Spot
hard.
on.
Same thing, and the same thing goes for the London team with me and Grace as well.
We try to reach people online as well on Facebook and Twitter and direct people to our website. So we try to do a variety of different things because obviously we've got lots of different audiences. So we know we need to do different things to reach different people.
Okay.
And the same with Keyring, really. We have a fantastic marketing and comms person who's on the call today, Charlie, who does all our social media, who's really active on our Twitter feeds. But the key bit for Keyring is that we are a local, we work locally with communities. And as Leighton and Sam talked about earlier, we try and get the communities to kind of give all of their information to as many people as possible. We use community resources, you know, we link people together, we do online things, and obviously through social media is a massive part of what we try and do. Please do go and have a look at our website, which is www.keyring.org, or follow us on Twitter, and hopefully Charlie can put in the chat the Twitter handle and she'll tell you how rubbish I am at doing all of that. But we try and work locally with the people that we support. The teams are local, and that's how we try and do it, really.
So how are you going to reach? Because I'm based in London area. How are you going to reach like not only the local area but national?
Keyring are a national organisation, so we support probably about 2,500 people across the country. We do have services in London that covers the whole of London, so there will be a group close to you or a team that works close to you. So we do work local, but we also do work national, and my role is a national role. So I take all the good stuff that's happening around the country and I try and link people together. And we're working very closely with SeeAbility in the North and in London on getting the information out there. So we do try and link in with local and national organisations as well, because we're not the experts on everything. We try and plug ourselves into the people who are, you know, and we very much try and signpost people that we support to the services that are going to make the difference to them, really. So hopefully that will answer it. And if you're able to go on our website, it kind of tells you where we are around the country and who's closest to you. But we work Bexley, Croydon, and across South London as well. So we will have teams that hopefully will be near you. If you want to contact me directly, I can put my email address in the chat if that's helpful.
Okay.
Great, thank you. And we're at 29 minutes past, so I'm going to say that's the end of our questions there. But if anyone does have any extra questions, I can help them get to the speakers that you would like them to go to. So do just let me know. You can drop me an email replying to the links from earlier. But otherwise, thank you very much for coming, and thank you very much to our speakers who've done such a great job today presenting. Lovely to see you all, and hopefully see you at another session soon.
Thank you.
Thank you.
Thanks, everybody.
Thanks, everyone.
Thanks,
Cheers.
everyone.
Bye.